Yeah, I ain't no suit-wearing businessman like you. You know, I'm just a gangster, I suppose, and I want my corners.
Welcome, welcome, welcome to the Five Corners podcast. I am Jet Bonifay, and on the other line, he's been actively looking for a socially distant barbershop since Texas opened up. It's Ace Merluzza. What's up, brother?
What's up, fellas? Glad to be here, pivoting away from sports for a little bit. And I'm actually stoked to check out a gym on Monday.
Oh boy!
I'm kidding, of course. I'm kidding.
Okay,
I gotta wait it out. I gotta
all
wait
right,
it
good.
out.
Please do. All right. As many of you may or may not be aware, May is the Asian Pacific Heritage Month. And to celebrate, we will be doing some interviews with members of the Asian Pacific Islander community, making a difference. And in light of what's been going on in the world, our very first guest will be an ER nurse on the front lines of the fight with the coronavirus. And he also happens to be my younger brother. So welcome to the show, Jeremy Bonifay. How are you, sir?
Very good. Long-time listener, first-time caller.
So give us your official title, what state you're practicing in, and how long you've been an RN.
So I'm a clinical coordinator of a community hospital in Pennsylvania, close to Philly. I'm in charge of the workflow process of getting patients into and out of the department as quickly and efficiently as possible. I've been an ER nurse for about 4 years now. So.
Nice. So you've seen a lot of stuff go down in the trenches, I would imagine.
Quite a bit.
So give us a rundown real quick of how you got into the field of nursing.
So my road to nursing is a very long and winding road, but to the nuts and bolts of it, I always had a desire to help others. I wanted a job and a career that was very fulfilling and being able to help others. So I was drawn to healthcare, and our mother, being a phenomenal nurse of 30 plus years, I saw her dedication and commitment to her patients, and for me that was astounding and remarkable. So that's what initially caused me to want to go into nursing.
Shout out to Mom, Bellevue Hospital.
Double shout out to Tita Fe. We see you. So Jeremy, of all the nursing specialties, what specifically about ER nursing attracted you?
So for me, I love the fast-paced environment of the ER. And you try to get them situated and stabilized and get them to where they need to go. Although my brother can attest otherwise, I am not the type to sit back and lay back and allow things to happen, even though
That's a new development.
I was going to say he would say otherwise, but I enjoy always being on the move, being hands-on, helping everyone as much as I can. And working in the psych ER in Manhattan, before I became a nurse, made me want to work in an emergency room. And then I did one day during my critical care rotation, and I spent one whole day in the ER, and I was like, this is for me. So, and the rest is history.
So that's pretty rare, right? Like most people don't jump at the chance to be under fire, I guess. I mean, you've told me some stories, personally between us, but it sounds like you're under siege most of the day. Is that an accurate, assessment of what your day looks like?
Yeah, for the emergency room, you never know what's come through your doors. It's always a new day, a new patient, a new scenario. It all depends on the day and what's going on. And right now, pandemic, and that's pretty much everything that's been on our minds and our situations now. But it's always something new, which is what we deal with.
So you mentioned, obviously the pandemic is impacting what you guys are running into. What was it before shit hit the fan? How was it? When did you start feeling the shifting of the momentum of the pandemic happening?
So we really didn't see it. It didn't hit us like a brick wall. It kind of transitioned into it. We started hearing news about it. We kind of brushed it aside. I honestly, when I started, I didn't even take it seriously. ER nurses, we always correlate everything to or compare everything to the flu season. For us, the flu season is like your peak season. It's always busy. You're going 100 miles a minute, and everyone's getting sick. I was very strongly mistaken.
So what was there like a moment, a day in time that you said, Oh man, this is for real now. Like what was that day for you, if you can remember it?
So for me, in the clinical setting, it was when we started bringing out all the PPE, the personal protective equipment, and we were really bringing in new policies and procedures. And I was like, this is interesting that we're doing all these things for something that kind of equates to the flu. Outside of the clinical settings, for me, it was the statistics. We always learn numbers never lie, and when I started seeing all these numbers, I started looking into what is this about, what's happening, because we didn't really see as many cases as you guys did in New York and New Jersey until relatively recently. So and then for me, the straw that broke the camel's back was when I visited one of our, when I visited our intensive care unit. And for me, it was something I had never seen in my 4 years as an ER nurse. There were ventilators everywhere, IV pumps. There was staff all in PPE and running around. It was like a war zone kind of.
So when was that? What was the month from a timeline perspective, just to give our audience?
So probably about, I would say like 2 months ago, a month and a half ago was when it started to really upticking. Um, we really haven't seen. We were seeing quite a few number of patients before the uh, all this started. We've actually seen lower numbers of patients because everyone's been staying inside and haven't been exposed as much, but they're sicker. So yeah, I would say about a month and a half to 2 months is when we started seeing a lot of it.
And how are you holding up every day at work, Joe?
Every day is a challenge. It takes a whole lot to strike up the courage to even walk through those doors some days. In the back of our minds, we're wondering, did I contract it? Are our coworkers, who we call family, safe? We work 3 12-hour shifts with them, and we want to make sure that they're going home safe to their families and they're coming back in to help us. How are our numbers looking? And then at the end of the shift, we're wondering, did we wash our hands enough? Did we decontaminate enough? Or are we contaminated? Can we safely go home to our families and not infect them? Um, so it's a really big mental battle as well right now, as well as a physical and emotional battle.
So you mentioned that, right? So what happens then in that case when a COVID patient comes through or at least a COVID presumed patient comes through the door? What do you guys do? How do you guys prepare for it? I mean, I'm assuming 80, 90, 100% of the patients in the ER are probably presumed COVID, right?
Yeah, so especially for our hospital, we have a lot of nursing homes around us, and they're the most susceptible population to this virus. But nowadays, we presume everyone as a potential positive, possible COVID patient. So as soon as they walk through the doors, they're already a COVID patient unless proven otherwise. So they put them on contact and droplet isolation, which means contact because the virus will stay on surfaces and objects. So you need to wear gloves and gowns, and then droplet isolation because it is transmitted through mucosal secretion. So sneezing, coughing, talking, even spitting, those types of ways. So that's why we will all wear masks and N95 masks to help decrease that infection rate. And then for those patients, we just try our best to stabilize them and get them to if they're stable enough to go home or get them admitted.
So what happens in that case when what's the barometer for saying that somebody either gets to go home or gets admitted? What are those, milepost markers from an ER standpoint?
So for us, we want to make sure that we're discharging patients and they're capable of being able to take care of themselves. A lot of these nursing home patients, once they contract the illness, they won't be able to take care of themselves immunologically. So we have to admit them and then give them supportive care when they're here. For the younger population, we probably will give them IV fluids, give them some breathing treatments. If we feel like they're good enough and that they can follow our discharge instructions, we can send them home and be certain that they'll be able to battle the virus in the comfort of their home.
So we're hearing a lot that, you know, um, the statuses of these patients decrease very, very quickly, right? The prognosis becomes really bad, really fast. What happens in that case when it go and you mentioned it a couple of times to me, you know, the happy hypoxic, things like that. What do you guys deal? What do you guys deal with? How do you guys deal with that situation when it goes from the person was doing okay, all of a sudden, you know, they're having to be intubated?
Um, so we try our best to do whatever we can to keep the patient breathing. So for us, it's always airway, breathing, circulation. So if these patients aren't breathing appropriately or oxygenating appropriately, they start losing function to their brain, their muscles, their heart. It all becomes a cascade of issues. So for us, our biggest thing is making sure that they're breathing. And that's the issue with this virus is it's causing a lot of respiratory failure where their lungs aren't able to oxygenate their bodies enough. So typically we try to maintain a pulse ox, which is the oxygen saturation throughout the body of above 94%. Some of these patients are coming in the 60s and 70s,
Wow.
but they're talking to you normally, and we're like, this is so weird. It has to be like a user error or a malfunction, but it's pretty much how it is. But then they decline very precipitously.
So what happens in that case when they do decline? What do you do?
So we always when prior to all this, we would intubate almost immediately because the longer you spend at that lower oxygen level, the more damage to the brain occurs. And once you lose functions to the brain, everything starts failing because you start having like stroke symptoms or just hypoxic symptoms where you're not comprehending thoroughly. Um, so for us, we were always intubating these patients quickly. However, recently we're trying to not intubate because it's been showing more that the more these patients are intubated, the less likely they do well once they're off.
So what's the alternative from intubation?
So there's other modes of ventilation. We try to use high flow nasal cannulas. So the prongs that a lot of people usually see that go into the nose and goes around the ears. We try to do that first and see if they're stable enough to maintain on that alone. If that's not working, then we keep going and going until finally, eventually, we end up intubating if that's the end scenario.
So it sounds like there's obviously this is a novel, right? Coronavirus. So it sounds like you're learning a lot. So what has changed, you know, with the procedures, the processes since this started? You know, how has the flow gotten in terms of people going into the ER? How have you guys been treating it? What has changed from like, you know, 2.5 months ago to what you guys are doing now?
So like you said, it's a novel virus, so we don't know what's going to happen, and we have ideas of previous viruses and things related to it. However, um, we don't know because it's all so relatively new and things will keep changing and policies will be updated, and we're just rolling with the punches. These last few months have been a roller coaster ride. It's been ups and downs. Things have gotten better, things have gotten worse. However, like you said, it's a learning process. We're just doing the best we can to just deal with the situation, keep trudging through.
And you mentioned roller coaster ride. Like while riding that roller coaster, I mean, what about the other non-COVID cases? I mean, um, do they get as much attention? I mean, how do you kind of prioritize these other cases along with your COVID patients?
So even though the pandemic is going on, that doesn't mean that the other emergencies just stop. People are still coming in with heart attacks, strokes, gastrointestinal bleeds, fractures, traumas, so on and so forth. So we're still trying to keep up with the emergencies that are still coming in, but we're still having to deal with the fact that there is a highly virulent virus going around that it makes our job a little bit harder because as ER nurses, we're trained to jump in and start helping because we have minutes to save people's lives sometimes.
You know, obviously with all the precautions you just mentioned about, you know, making sure you're decontaminating yourself, wearing PPE all the time. I know Cindy, shout out to Cindy, is also in the healthcare worker line. She's a pharmacist. So how has this changed your daily life? Obviously, you're an extremely, you're an extremely high infection risk, right? So what are you doing every day to kind of mitigate that risk of spreading the infection or bringing it home?
So beforehand, we would just go about our day, jump into our cars, drive home, take off our scrubs, and go to sleep because I'm a night shift nurse. So I go right to sleep because you're exhausted. But now we have to take extra steps when we are leaving the hospital to make sure that we're not bringing it out of the hospital. So a lot of nurses now, they're bringing clothes from home that are clean, will change out of their scrubs at the hospital. For me, I change my shoes out in my trunk and then leave my dirty nursing shoes in my trunk and wear clean shoes in. And then as soon as I get into the house, I take off all my scrubs and throw them directly into the wash and take a hot shower to make sure I don't throw the virus into my bed or into the food I eat or what have you, that it could be on me. So a lot of nurses are taking extra steps before they leave or when they get home to make sure that they aren't infecting the people that they love or their loved ones or their families or pets and stuff.
So how many minutes, hours is it adding to your daily routine? What is that? I mean, that sounds like a pretty exhaustive means and obviously necessary, right? But how many minutes is it adding to your everyday routine?
So it can vary between, for me it's about an extra 15 minutes per shift. To some nurses it takes them 30-45 minutes because like I said, they're changing into new clothes or they're taking longer showers when they get home or they're taking these extra measures. um, for a nurse taking care of patients, it's enormous. We're gowning up, putting on masks in and day out, so it's adding minutes to all of the patients that we're seeing.
How much longer are your showers, Jeremy?
Uh Extra 30 minutes. I make sure to no, I as soon as I get home, probably like a 15-minute shower, a normal scrub down just to make sure I'm when I go to sleep, I'm not worrying like, geez, am I lying on is it you, Rona, next to me? So just to make sure that I'm not like in my bed sleeping with Rona. So
I mean, obviously, right now, this disease has killed over 300,000 people worldwide, over 80,000 in the United States. What's the worst part besides the death toll, that you've seen every day at your work?
for me, it's that these patients are alone. These are the sickest that they've ever been. It's the most trying times of their lives, and there's no one at the bedside with them. There's no one to comfort them. There's no one to support them, and they're just sitting there trying to get better by themselves, or with a nurse who's gowned up from head to toe, and you can only see their eyes, and even their eyes, they're covered in protective eyewear, so it's not really their eyes.
Wow.
So it's a one thing that a lot of people don't realize is like these patients, they're hospitalized and they're getting sick, but they're getting sick by themselves. If anyone who's ever been hospitalized, they know that they wanted to have family with them and spend time with them and be there at their side because it's a support mechanism. It helps in the healing process. However, these patients don't get that now. They're by themselves. They're isolated. And on top of that, the patients that are dying, it's sad to say they aren't really dying with a lot of dignity. Um, they don't feel the warm touch of the nurse holding their hand as they're passing on, or with their loved ones around them as they're saying their goodbyes. A lot of them don't even get to say the goodbye. So that's a depressing thought for a lot of nurses.
Has the hospital done anything to try to bridge that? I know some hospitals have been giving out iPads, trying to contact loved ones, things of that nature. How has your hospital been dealing with that?
So our hospital has been pretty great about this because they know our CEO or our CNO is a nurse. So she tried every means, which just like you said, they give them iPads and they allow them to FaceTime and Zoom. And we actually have a support team that rounds to check up on the nurses and see who they need to spend extra time with. Because as a nurse with a heavy patient load, it's hard to sit there and call every single one of their loved ones because you still have other patients you have to take care of. Um, Luckily, with this new team, they go around and assist that nurse with helping them contact their family members and making it not seem so isolated and alone. So I think it's a great feat for them to be able to do that for these patients.
And what do you think the next 6 months and 12 months will look like going forward? especially with everything starting to reopen, but more and more cases being reported?
So it's going to be an interesting time. I feel like masks are going to be a regular occurrence as they are now. We kind of looked down upon it with the other Asian countries where they were wearing masks all the time. With other previous to COVID, they were wearing masks on subways and to the markets before all this. So now this is what we're doing, and um, for the patients, I think they're going to need a lot of assistance getting back to where they were before the illness. So we're going to be relying heavily on physical therapists to assist them with moving and getting back to walking, because a lot of these patients are spending extended amounts of days, probably like 14 plus days in the hospital, in a bed, or occupational therapists helping them transition back to where they were working or living. So it's going to be an interesting time, and for the healthcare professionals, honestly, I think there's going to be a lot of PTSD and anxiety for these nurses, because it's not natural to deal with this much death in such a short time span. And right now, they're doing their best, and they're. I feel like it's a lot of the like bravado and like the internal strength that the nurses have. But I think once that like sympathetic nervous system shuts down and it's no longer the epinephrine running through their system, I think it's gonna hit them harder than a lot of people are analyzing.
Any mental health things that they're trying to help you guys out with?
Yeah, so it's good because they allow us like special services that if we have to talk to anyone about anything, it's like um a a hotline that we could call, and a means for us to just unload. It takes a lot out of a nurse, but just being able to talk and verbalize and just being able to speak your mind, because we're taking care of these patients 12 hours a day for our 12-hour shifts, and we aren't able to talk about it except to our coworkers. But they're also living in it as well. So we kind of need a third party person to just listen to us, and just so that we feel like we're just not spewing or brewing in our thoughts or ruminating. So it's a great thing that they provide us that. And honestly, just talking to you guys or talking to someone who isn't in the healthcare, because then they can see from our perspective what's going on.
And that's a big reason why Jet and I brought this back after a hiatus, and we discussed at length how there was a point in time where we just didn't feel like doing anything at all. So just to expound at that point. But is there anything in particular that you miss during the lockdown?
So for me, the biggest thing that I miss is being able to just visit family and friends. So like seeing my nephew, I see the videos of him at home, or we Zoom call him. However, it's not the same not being able to hear him in person, and just being able to play and have fun with him. So I think that's the biggest one, and just being able to spend time with your family, eating dinner with them. Even though I'm in Pennsylvania and it's hard for me to come visit, when I do get to visit, I can sit down and eat and talk in person with them. It's a different kind of vibe when you're on a Zoom call, because there's a barrier. It's not the same as being side by side and getting the firsthand account. Um, and the other menial things like just going to the movies or perusing the mall or shopping without feeling like your life is in peril. Just being able to just walk up and down the aisles, buying unnecessary things at Target. Um, just the small things. And for me, playing live poker. So.
So, and not many people know this, but you're slated to have a wedding in October. So any changes to your plans so far? Anything that you guys have been thinking about, speaking about missing things and things of that nature?
So we're kind of on the brink of things. We're actually gonna have to call our venue in June or July to find out like what's the plan, because I was talking about it with my doctor last night. The CDC is going to recommend gatherings of less than 50 people.
Right.
Even after all of this, even when they start reopening, we're aiming to have like a fairly large wedding. That's, as healthcare professionals, I feel like we're being hypocrites by not following that guideline. So
Unlike the president,
no, of course,
wear a mask.
doesn't
Oh.
wear a mask and say, "Go ask China" to the Asian reporter. Yeah, um, yeah. It for us. We think it's irresponsible for us. I talked about it with Cindy, and we have to reevaluate it. I think closer to that time. Well, probably like I said, June or July. We're gonna have to touch base with them and find out, hey, what's going on? Because like I said, I feel it'd be irresponsible of us to have such a large venue and gathering of everyone who are also healthcare professionals.
Right, right. Who should know better, right?
Yeah, in one space, possibly spreading it even more. So,
You know, to the point that you're mentioning that the breakout in New York, it started with a super spreader, a person that got infected that went to a wedding. It was a Jewish wedding, and it was over 250 people. And it's exactly what you said. It becomes a venue, especially for you guys, right? I mean, you know, obviously we want to be there, but the thought of having a bunch of healthcare workers who may have been exposed all in one enclosed space could be problematic and could be a contagion vector, right?
yeah, and even the fact that some of them aren't healthcare professionals, that people have immunocompromised family members at home, or we don't know. Yeah, we don't know who they're going home to. We don't know if they have like a child who's on cancer medications, or an elderly like grandmother who's very ill. Like we don't know that, so we're not gonna want to be a vector for that to happen. So we're like I said, we're gonna have to reevaluate when time rolls around.
So it's kind of funny you mentioned that 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 sentiment is almost the exact opposite of the people that are kind of, you know, saying to open up. So have you run into, you know, whether you're in your scrubs or whether in the hospital, have you run into any type of either racism or pushback against the fact that you're a nurse, that you guys are trying to do this stuff, which is kind of crazy during a pandemic, but this is America, so it's not out of the realm of possibilities.
So I haven't encountered an increase in racism. uh,
Just your normal everyday old racism.
Oh
normal,
yeah, this
like
is the good
so.
stuff.
Yeah, I've gotten the typical, "What type of Oriental are you?" Um,
Sweet
yeah.
sism.
Where are you from? And then I tell them I'm originally from New Jersey, and then they say, "Oh no, where are your parents from?" And then I have to go through the whole spiel, like, "Oh, here we go. You can have said, hey, what nationality are you?" Or, but that's besides the point. Um, actually, Cindy actually had an actual incident where on our cul-de-sac, she was walking our dogs, and our neighbor,
I love how you put that in air quotes.
neighbor told her not to walk on her sidewalk because she was an Asian female in scrubs walking the dogs, and this is all when it all was starting. So it was kind of a shock for her, and so it's like I said, that was probably the only incident. But again, there's still a baseline of not like racism per se, but an increase in knowledge that needs to be that needs to be
Baseline, yeah, racial ignorance is just always prevalent in America.
Anti-vaxxers. Do you think this will change their
I thought you were going to end
opinion
I thought you were going to
on
end
their stance?
there, just anti-vaxxers.
Anti-vaxxers. That's all you need.
Anti-vaxxers. Do you think this will change their opinion on their stance?
So I haven't really heard anything about it recently for anti-vaxxers, but for a lot of them, it's starting to hit home, I think, because now these numbers and statistics are actually affecting people that they know. It's not like the measles or rubella or things that like they were which were cured by vaccines that they don't see. This is now a virus that they're seeing, and it's prevalent for them. So now I think it's starting to hit home, and they're vying for like the vaccine so that it stops. But I think it's all a cycle, and eventually later on, if we do get a coronavirus or a COVID vaccine, there's going to be a similar anti-vaccine sentiment later on down the road, I think, for that.
So what do you want to tell those people? Because they generally run in the same circles, right? Those same anti-vax people and these same morons that are showing up at the steps of Capitol buildings. What do you want to tell these protesters and the people that are looking to try to get the economy in the country open as fast as possible?
So I think they aren't taking into account the other things associated with having a pandemic go on. There's logistical things, and you probably know like better than anyone. Like there's a lot of logistical cogs and turning wheels that need to occur for things to work 100%. There are limiting factors that they aren't taking into account. Like we have limited number of nurses, doctors, physician assistants, respiratory therapists. If they get sick, who's then going to take care of the sick? They don't realize like if let's say I get sick, I'm an ER nurse. It's kind of like a very specialized environment. If I get sick and we start running out of ER nurses, they're gonna have to take someone from a different specialty to then fill my position, who probably hasn't worked in an emergency room. And this is the issue that New York kind of had, was they had to find nurses to fill these positions. Um, and if those nurses are gone, who's then going to take care of the sick? And I think the biggest thing that's upsetting is they're all saying it's all older people and whatnot. Do they not count as people? They're also people as well. They're older, they're more susceptible, and they've lived their life and they've provided for this country already. Why are we giving them a disservice by saying it's only the older people? Um, so I think that's the biggest disrespect, is like as Filipinos, we're always looking up to like our elders and taking care of like our family members.
Good point.
This is more like, hey, they're old, they're wrinkly, let's get them out of here. It's only the strong that will survive. Like, what about them? They live their lives and they help raise you to be where you are now. Why are we treating them like this now? So I think it's a big slap in the face to the healthcare providers who are going every day to work, caring for these sick people who are also getting sick. And then for our geriatric population who we're kind of turning our backs on.
So what, and again, I think the reason why people are so arrogant and cavalier, right, is because it's never touched them. So, maybe relay to our audience, what's the worst day you've had so far since this thing kind of came about? What's the absolute lowest that you've been at?
So for me, there wasn't a really a particular day. For me, it kind of all added together. Because for us, we always try to just get through our day and go home, sleep, and then rinse and repeat. However, what a lot of nurses don't realize is it adds up. And honestly, for me, one day I was just driving and I just started breaking down and crying because it was just so exhausting and tiring and emotionally draining that you don't realize it's affecting you until it hits you. You're trying your best to save your patients and you're throwing everything but the kitchen sink at them, and you still have a negative outcome. And then you try to go home to decompress and leave work, but you hear about COVID on the news. It's on your social media. You can't go to the store without remembering to wear a mask that you've been wearing for 12 hours already. You now have to wear it when you're on your day off, or that you see these people who are up like less than 6 feet coughing on each other or what have you. It's hard to shut off your brain and decompress because you're going to have to rinse and repeat and do it again. And it's like there's a never ending cycle for the healthcare providers because it's going to be going on 24/7, 7 days a week. And it's hard. We just can't decompress, and it's taking a toll on us.
Yeah, I got two questions for you actually.
Yeah.
Is the worst behind you, in your opinion, for the nursing community? And what do you want to tell protesters and those that are looking to open up now? And I ask that because I live amongst them, and I live in the capital state, so that's a prime place for protesters. So interested to hear what your thoughts are regarding that.
So it's hard to say because it's like you said, it's an ebb and flow. It's a roller coaster ride. We'll have an increase in cases, we'll have a decrease in cases. It's difficult to say because it's all depending on the reporting bodies that are giving the numbers. But in the end, it's still, although they're numbers, these are people and they're patients. And uh, if they that's why I actually support the like the medical professionals that are um trying to say not to open up, because if we open up, we're allowing us more leeway to get others sick, and they're not taking into account other like facets of it that we have to remember. uh I don't know, it's an interesting case. As the more we open up, I know the economy is doing pretty bad and people want to get back to work, but like I said, we don't know what people are going home to. They may have those, like I said, we've had patients who have cancer family members who they can't go home to, or they're also healthcare providers and they're going to be handing it off to their patients. So it's hard to really put it all together into one scenario and say it's a definitive let's open, let's close. It's just like our jobs. It's an ebb and flow. It's a roller coaster. They have to do it day by day, in my opinion.
All right, so we're gonna do before we kind of wrap this bad boy up, we're gonna do a COVID conspiracy carousel lightning round. So I want you to answer facts B for anything that you believe is true, or bullshit if it's total bullshit. All right.
All right.
Okay, so it's pretty easy. Is COVID-19 a bioweapon made by the Chinese?
China.
Oh, you mean the Wuhan flu? False. I do not believe it was a bioweapon made by the Chinese.
Okay. Are hospitals getting paid more if they indicate the death is a coronavirus death?
That is false. The doctors are not in big pharma's pockets. They are not getting paid every $1,000 for a coronavirus death. No, we are there to help patients.
Are you sure? Because my friend on Facebook who barely passed, biology, keeps telling me that it definitely is the case.
Kickback.
No, my favorite is the Facebook thing where the doctor, like, oh, let me give you my timeline. 6 a.m. Let me wake up and roll off my pile of money that Big Pharma gave me. Uh, let me go to my meeting where they give me a briefcase full of money for all the essential oils that I prescribe. No,
Okay, so that's false.
that is not the case.
All right. Are all deaths being counted COVID?
They are not. It's hard to say that if they're all, because they're presenting very differently. But uh, we actually feel like it's being underreported. So
So
because
can you speak a little bit to how that process actually works, so to kind of educate our audience?
Gotcha. So if anyone has seen like those TV shows, the crime scene, whatever's, it's actually true. If a patient expires in like the hospital, a medical examiner will determine if they need to do an autopsy or determine a cause of death. So they will then figure out if it was a COVID related death. However, with the high infectious rate and it being a novel virus, it's they're actually very backed up. Um, and the thing that a lot of people aren't realizing is the patients who are dying at home. They're if it is a COVID related death, they won't know until they go to the medical examiner, if even if it is a medical examiner case. So some of them will go to the medical examiner, others won't. So if anything, we think that it's more underreported than anything.
Okay. Will drinking disinfectant kill the virus from the inside?
It will, but you will also die with the virus. So if
You're
so,
saying it's possible.
uh, if you also want to go down with the Titanic, then yes, but please do not drink disinfectant. We've actually had multiple calls about that, and it is not true. Do not drink disinfectant or bleach or whatnot. That is not
Have
helpful.
you had any cases of people coming into the ER who have ingested it, or no?
We have not, but we've had people call in and ask if it was true, and if
Really? People wanted to know if that actually is a feasible way to get rid of coronavirus.
well, yeah, well, you have to think like you have to take into the spectrum the knowledge level of people. Uh, if the people think the president has the best knowledge because he has advisors who are paid to look into these things.
Great
So
point.
if he says something and they're watching the news and this is their only means of reliable source of information, they're going to think that this is the all up-to-date information. So they're going to say, well, is this true? It, however, is not.
Okay, so on the same vein, can I shine UV into my bloodstream and kill the coronavirus?
If you want to shine and be luminescent in the dark, then yes, but no, it will not kill coronavirus. It is not so there is a means of using light in cancer patients, but it is a final means, like a last ditch effort to try to rid cancer cells. But no, it is not a viable option to kill coronavirus in the bloodstream.
You're really dashing the hopes of our audience here.
I
Does
know,
wearing
sorry.
does wearing a mask activate coronavirus, as the pandemic has so willfully mentioned?
So I have not watched Pandemic, and I strongly do not want to watch it. And what do they mean by activate? Is it like Yu-Gi-Oh? You're activating a trap? Like I
I'm not really sure. I think what they're saying is because you're breathing it back into your system that somehow it comes back to life. I don't know.
no, this isn't like a mummy. It does not die then come back. The mask helps protect you, and it helps protect others. Uh, I love the one good thing about social media are the memes that come out, and the healthcare meme was like wearing pants.
Yes, we posted this. Five
Yes,
Corners Podcast on Facebook. Check it out. We
I
posted
I
it.
I loved it. If no one wears pants and everyone pees, you're gonna pee on each other. If one person wears pants, the other person can pee on you, but you won't pee on them. If you both wear pants, you can pee in your pants, and no one's gonna get wet but you. And then you can clean up, and then you're fine. So I like that whole pants theory. It was perfect.
Okay, so nurse says wear pants. Got it.
Wear pants, please.
Does your immune system get weaker the longer you stay indoors?
No, you are born with an immune system, and then if anything, it's getting better by not being exposed to it, especially for a novel coronavirus. Uh, your body will get it no matter what. You have no immunoglobulins for it. You have no means to fight against it. You will get it, and you will get sick. So please try to stay home. And oh goodness, I can't believe these are questions.
Can Bill Gates track me through a coronavirus vaccine?
like like a chip for the dogs?
Yes, like a chip. Can they put a chip in my vaccine when they inject me with it when that happens?
Because we have we want to track you.
Nanobots.
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 The gray theory. What is that called?
Yes, gray goop theory.
Gray goop theory. No,
You're saying no, not possible?
I don't. I think Bill Gates has other things to worry about than tracking one individual person with their coronavirus vaccine.
Telling you, you're batting 0 for 10 right now. And everybody on Facebook keeps saying these are the things. All right. Finally, does 5G cause coronavirus?
It does not. Oh, because apparently I cannot even get 5G because I am dropping my Wi-Fi. So it does not cause coronavirus. It is a virus. It is not transmitted through electromagnetic waves. So please, it is not through 5G.
Okay. You've debunked a lot of our biggest hopes and dreams here, but okay, I believe you. You're a healthcare provider.
All right, good.
One more question. Does being the leading nation in test administration for COVID make us safer?
So it's good to test. It's important to test. That's the only means for us to open. So, because for us, if we test, we can track where the virus is, and people will know when to stay home, when when they could go back to work. But if we are testing, I feel like we aren't testing enough. So.
But we're the leaders, though. I mean, Trump had those banners at his press conference.
Yeah, but
that's the president.
He, the leading informer. He drinking bleach and putting UV rays into our body somehow. When he was talking about virus living on non-living surfaces? Yes. See, I understood what the guy was talking about during that interview. He did not, obviously. So.
All right, man. We're very proud of you. I'm very proud of you. Obviously, I've known you all your life. So again, like I said, what you're doing is God's work. I've always said this. Everybody from the entire line all the way down, doctors, nurses, nurse practitioners, everybody, even to the custodial staff, right? The ones that clean up those rooms. You guys are literally going into a war zone every day. So we're here for you. I miss you a shit ton. Obviously, the boys miss you, right? Like you mentioned. So we want you to keep staying safe, and keep getting through it, man. Every day, I think, again, like I said, you're doing God's work, and we're praying to keep you and your family safe. Go ahead, Ace.
Yes, sir. I'm definitely liking the Cuomo primetime bro vibes right here. glad to be a part of it. Jeremy, I'm really proud of you, bro. I think I'm probably one of the few friends of your brothers that's actually known you since you were a baby. So to see you do what you do now, I think I feel that same amount of pride just seeing where you came from. Wishing you all the best for you and Cindy, and hopefully you'll be able to invite everybody to your wedding. So keep up the good work, brother.
Thank you.
Any last thoughts from you?
Yeah, just thanks for having me. And like I said, I just want everyone to stay safe, stay healthy, and wash your hands.
All right, man. I love you, brother.
One last thing. I just want you to say one last thing, if you can.
What's that?
I'm only a kid.
I'm only a kid.
I love it. I love it. I love it.
That's the one. All right. Once again, thank you for joining us, Jeremy Bonifay. Keep doing the good work out there. Keep fighting the good fight. We appreciate you. Thanks to everybody in our audience for watching and listening. We appreciate everybody. We'll check you later. Peace.
Peace.
See ya.